Hello, everyone. I'm Jack. Welcome to this tour that shows how Hixny connects everyone involved in a patient's care. Our goal is to provide you with an engaging and entertaining virtual tour that mimics a true-to-life patient scenario. The foundation of this connection is the Hixny Health Information Exchange, what we call the HIE, or just Hixny. It's a secure system for authorized healthcare providers and patients to share patient health information. I would like to call your attention to the two frames you see on the left and right of your screen. On the left frame, we will represent the system that is being used at the point of care in each of these three settings, while the frame on the right will represent the Hixny HIE, displaying the records as they build after each patient encounter. We will demonstrate how Hixny helps provide safer, more efficient care every day to people like us across our community. You'll join a patient as she visits her primary care provider, experiences a trip to the emergency department, and finally participates more fully in her own care using the Hixny Secure Patient Portal. I'd like you to meet Bonnie, our patient for this demonstration. Bonnie lived in Hudson, New York, and has just moved 60 miles north to Glens Falls, New York, and is visiting a new primary care provider. The first thing Bonnie does when she arrives is sign a Hixny consent form as part of her registration process.
Signing yes to the Hixny consent form gives my doctor permission to access my health records through Hixny. Hixny has information on more than 1.5 million patients in our region, but healthcare providers can only look at my medical records if I sign a consent form.
Most physician practices today use an electronic medical record system, or EMR, to store and track patient information within their practice. Bonnie's primary care practice uses Athena Health, which is connected to Hixny, so it's easy for her doctor to see her health information from other sources and share it with other providers who participate in Bonnie's care. When transferring from one doctor to another, Bonnie didn't have to take any time off from work to pick up copies of her medical records or make phone calls for the results of her blood work. Plus, she doesn't waste time or money having tests done a second time. Through Hixny, everything is available to connected providers securely and efficiently.
I pull up the Hixny record directly in my Athena Health EMR system. It includes the information from Bonnie's last primary care physician.
I have multiple medical conditions that I've been trying to keep on top of lately. What's nice, though, is through Hixny, my new doctor can easily view my records from my old doctor. This also helps the nurse that just interviewed me to get a baseline for my allergies, medications, and other important information. As you know, it's difficult to remember all of that.
I can see through Hixny that Bonnie recently had blood work done, which gives me a good baseline to work from. Her thyroid function is normal, so that is something I don't need to order right now. Bonnie has multiple conditions. However, I am most concerned about the upward trend of her diabetic measurement, which indicates how well Bonnie is controlling her diabetes. While counseling the patient to better care for her diabetes, I also decide to increase the dose of her anti-diabetic medication. What is nice is that I can choose specific parts of the Hixny record, and my Athena Health system adds this information directly into my record for Bonnie.
Every healthcare provider that participates in Hixny not only accesses patient information from Hixny, but also adds and updates information when they see a patient, helping to create a more comprehensive record for other downstream providers. Currently, all of the region's hospitals and a majority of practices already participate in Hixny, bringing value to the community on a daily basis. Frequently, new healthcare organizations are brought on board, adding to the value and usefulness of Hixny.
Additionally, I order blood work to be performed at a lab next month because her hemoglobin A1C has a history of being high, and I'm hoping that after our visit today, Bonnie will work harder at keeping her blood sugar under control. Before Bonnie leaves, I add some notes to her health record in my Athena Health system and close out the visit. This automatically sends the record to Hixny. The record now includes vital signs, allergies, notes from this appointment, any medications she's on, basically everything we know about our patient at this point.
As you can see, Bonnie's record has now been updated with the information from her primary care physician. Included in the record is the recent clinical summary that was automatically sent to Hixny.
Saratoga, we're en route with a 45-year-old female who was found incoherent, nearly stuporous at home.
Unfortunately, Bonnie's next encounter is a visit to the emergency room. With all of the medications she takes, Bonnie forgot to fill her prescription for the new dose of anti-diabetic medication that her primary care physician ordered for her. She hasn't taken the medication for about a week now, and her blood sugar is out of control. She experienced an emergency situation and came into the ER close to being unconscious. Although Bonnie would be asked to sign a Hixny consent form in the ER, if she's incapacitated and unable to do so, clinicians are allowed to access her records from Hixny in an emergency situation. We call it break the glass.
It's in the emergency department where Hixny can save lives. Bonnie arrives at the hospital, but she's unable to tell me what medications she's on. That's okay. It's Hixny to the rescue. I can pull Bonnie's records from Hixny and immediately discover her health history and medications list. I know she's recently been to 2 different primary care providers and what the previous diagnoses are, as well as any allergies that she has. In this situation, Hixny can speak for the patient and tell me that this patient has a history of issues tied to her diabetes, giving me a good idea what may be causing her visit to the ER today. Specifically, her lab results, including one less than a month ago, tell me that Bonnie has a very difficult time controlling her diabetes.
Bonnie's symptoms still persist and her blood sugar is still high, so they keep her overnight in the hospital for observation. Fortunately for her, Bonnie's primary care physician subscribes to Hixny's notification service that allows her to receive real-time notifications on her patients. Upon Bonnie's discharge, Hixny will immediately send a notification to her primary care provider informing them of Bonnie's recent encounter. Once the discharge summary is signed off at the hospital, we send that along to the primary care provider as well.
A couple hours after my discharge, I get a call from my primary care physician. Hello?
Bonnie, it's Dr. Blood. I was just notified that you were discharged from Saratoga Hospital. I'd like to make sure you understand your discharge instructions and answer any questions you have. I'd also like to schedule you for a follow-up appointment. How are you feeling now?
A lot better. I'm still not sure exactly what happened.
It appears you forgot to fill your prescription for your diabetes. Do you have access to the Hixny patient portal?
Yes, I'm pulling it up right now.
You should be able to see your discharge medications in the portal. Also, I am going to refer you to Dr. Robert Jones, a diabetes specialist. I would like you to set an appointment with him.
After a long couple of days, I am exhausted, and all I was focused on was getting home. Trying to keep track of everything related to my hospital stay is proving difficult. Having online access to the instructions gives me peace of mind that I can view them from anywhere I need to and make sure I know exactly what to do next to prevent this from happening again. Additionally, you know that endocrinologist that my doctor just referred me to? Well, through the Hixny patient portal, I was able to securely email him to request an appointment and also send all of my records for review before my visit, saving me a lot of time.
When doctors have all the information right at their fingertips when they need it, think of the time this can save in determining what a patient's health issue might be and how to treat it. On the other hand, without Hixny, precious time can be lost and critical information missing when trying to choose the optimal treatment protocol in the emergency department or what medications are safe to prescribe. If you have any questions, please visit the experts at www.hixny.org.